So, what is there to be angry about this week? Well, it's called the Drug Enforcement Administration. Now, right off the bat, with a name like the Drug Enforcement Administration, you know it's gonna be bad. This agency can't possibly be doing anything good. But what they are doing is worse than even you and I would have guessed. The DEA is arresting doctors. Yes, they're arresting licensed medical physicians. For what, do you ask? Murder, mayhem, destruction, other evils? No. Charges of drug diversion? Apparently, if a doctor prescribes pain medication to a patient and then they go off and sell it, the doctor is responsible for that because they should have known. So what are doctors doing? Well, they stopped prescribing so much the medication. They don't want to be red flagged by the DEA. You don't want the DEA knocking on your door. No. Dr. Thomas Stinson. It is impossible to be sure that a patient is not diverting any of his medication. I fear I might be targeted. He is, of course, talking about the fact that he no longer prescribes large quantities of these medications because he fears he might be targeted. But don't trust me about what the DEA is doing. Let me tell you what they themselves claim to be doing. Alright, Joseph Ranazzisi of the DEA says that the DEA just wants to help physicians meet the challenge of ensuring the people who medically need drugs get them, and those who are diverting them don't. There is no objective pain test. Basically, when a patient says they're in pain, you can either believe them or not believe them. And whether or not you believe them probably depends upon some kind of personal relations, whether or not they've built a rapport with you. A physician is much better able to decide based upon an individual patient whether he thinks that they're diverting drugs or that they're actually in pain than a government bureaucracy or bureaucrat. So what the DEA has actually done is turned doctors who would otherwise be helping people into doctors that are afraid to do so. And the result? People who actually need these drugs, people who are living in constant pain, don't have access. Is this really the kind of state that we want to live in? Where people just live in pain because of government bureaucracy? No, I think not. I think not. Doctors are in the profession of prescribing medication. It's what they do. It's what they were trained to do. It's what we trust them to do. There is no reason for a bureaucratic agency to get involved in that. When they do get involved in it, bad things happen. These are not good things. People living in pain, doctors not feeling like they can prescribe medication, doctors being arrested for prescribing medication, all very bad things. These are not things we want in our society, people. Not things we want.